In those critical moments of life and death, some of the biggest, most difficult decisions can hinge on understanding just a single word. Today, we're going to dive deep into one of those words, burden.
So, to really get our heads around this, let's start with a hypothetical situation. I want you to imagine a 23-year-old woman. She's been in a coma, on a respirator, for 3 long months. And the doctors, they've confirmed there's just no reasonable hope for her to ever recover. So her family is facing this just impossible choice. Do they discontinue life support?
Ethically, a decision like this really comes down to two things. Is there any hope for recovery, which in this case there isn't, or is the burden of the treatment excessive? But for them to even begin to answer that, they have to know what burden actually means in a situation this heart-wrenching.
Okay, so to really help this family and ourselves, we need to step back from the story for a second and look at the ethical framework. Let's break down what medical ethics is actually talking about when they use the word burden.
You know, what's so fascinating about the official definition is one tiny little word, or. A family can ethically refuse treatment if there's no reasonable hope of recovery, or if the burden is excessive. They don't both have to be true. And that, right there, makes understanding burden all on its own absolutely critical. And this is where the idea gets, well, a lot more complicated. Because burden isn't just one simple thing. It's this multifaceted concept that has a whole lot of different faces. I mean, just look at this list. We're talking way beyond just physical pain for the patient. You've got the psychological toll on everyone, the deep emotional drain, the very, very real financial strain. And then you have the social impacts, the big spiritual questions that come up, and just the sheer amount of time, effort, and resources being poured into the situation. Can you imagine that family grappling with every single one of these? Here's a perfect example of what physical burden can look like. A treatment might technically be doing its job, but if it's incredibly harsh, super strenuous, especially for someone who's elderly, well, the treatment itself becomes the thing causing all the suffering.
And wow, this one really hits hard on the financial side of things. We're not just talking about paying some bills here. We're talking about complete devastation. The choice to keep going with the treatment that has no hope could literally mean a family loses everything. Their home, their security. That kind of ruin, that is a profound and ethically relevant burden.
So we've looked at what burden is, but now we've got to ask a really crucial question. Whose burden are we even talking about? Because the impact of this, it spreads out, kind of like ripples in a pond.
Ethically, there are really 3 distinct groups you have to consider. First, and this is the obvious one, is the patient herself. Second, it's the family and the caregivers, the people right there on the front lines. And third, a group we might not even think about at first, is society as a whole.
And this is a really, really important point. Let's go back to our hypothetical case. The patient is in a coma. She's not consciously aware of any burden. But, and this is key, the burden on her family, their emotional pain, their financial stress, their complete exhaustion, that still matters. It is a valid and central ethical factor in the decision.
All right, now let's zoom all the way out to that third and final circle, society. This is where the decisions can get even tougher because it forces all of us to face the reality of scarce resources.
This is where you get this really stark ethical conflict. So on one side, you have our patient's family. Let's say they can afford a very specific, scarce medical resource. But for their daughter, it's not going to lead to a recovery. But on the other side, you've got other patients in that same hospital who need that exact same resource, and for them, it could mean the difference between life and death. The ethical guidance here basically says that this kind of decision can't be made in a vacuum. The needs of the wider community, they should be part of the family's consideration. That's an almost impossibly hard thing to ask of someone, but it's part of how we calculate societal burden. And that brings us to the huge, final question that just kind of hangs in the air. There are no simple answers here. When the care for one person who has no hope of getting better directly impacts the survival chances of others, how do we decide? It's a profound question, not just for one family in one hospital room, but for all of us about what we really owe to each other.